Good morning, Doc. I'm John and I've got this weird rash on my leg. It's warm and tender to the touch. Started small, but it seems to be spreading. I see, John. How long have you had this rash? The doctor asked, pulling up a chair beside him. About 2 days now. I thought it might just be a bug bite, but it's getting worse. It's even a little painful, especially when I walk. All right, John, let's take a closer look and see what's going on, the doctor said reassuringly. I want to ask you a few questions about your medical history. Based on your symptoms, John, you might have something called cellulitis, the doctor began, his voice calm and steady. Cellulitis? What's that? It's a common bacterial skin infection, the doctor explained patiently. Basically, bacteria have gotten under your skin and caused this inflammation. It's important to treat it promptly to prevent any further complications, the doctor added, glancing at the concerned look on John's face. But don't worry, we'll discuss treatment options in detail later. So how did I get this cellulitis? Area clean and covered to prevent further infection. Proper wound care is crucial to avoid complications and to help the healing process. Of what to watch for and how to take care of your skin to prevent future infections. As John left the doctor's office, he nodded, jotting down his observations. Other symptoms can include fever, chills, and red streaks spreading from the rash. I haven't had a fever or chills, John said, relieved. But the redness does seem to be spreading a little. We'll keep a close eye on that, John, the doctor assured him. Early detection and treatment are key to preventing complications. What kind of complications, Doc? John asked, a hint of anxiety creeping into his voice. If left untreated, cellulitis can spread to deeper tissues and even the bloodstream. That sounds serious, John said, his face etched with concern. It can be, John, which is why we need to address this promptly. In rare cases, untreated cellulitis can lead to sepsis, a life-threatening condition. But with proper treatment, most people recover fully, right? Absolutely, John. With timely intervention, Cellulitis is highly treatable. So, how do you treat cellulitis? John asked, eager for solutions. He had been dealing with the discomfort and redness for a few days now, and the swelling seemed to be getting worse. The anxiety of not knowing what to do next was evident on his face. Antibiotics are the primary treatment for cellulitis, the doctor explained. This bacterial skin infection can spread rapidly if not treated promptly, so it's crucial to start the right medication as soon as possible. They effectively target and eliminate the bacteria causing the infection. The doctor went on to explain that there are different types of antibiotics, and the choice depends on the severity of the infection and the patient's medical history. Will I need to be hospitalized? John questioned, picturing needles and hospital beds. The thought of being admitted to the hospital was daunting, and he hoped for a simpler solution. Not necessarily, John, the doctor reassured him. Most cases of cellulitis can be managed with oral antibiotics taken at home. The doctor emphasized the importance of completing the full course of antibiotics to ensure the infection is fully eradicated. For most cases, oral antibiotics taken at home for a week or two are sufficient. The doctor also mentioned that it's important to keep the affected area clean and elevated to reduce swelling. That's a relief. John sighed, feeling a wave of reassurance wash over him. He had been worried about the possibility of a hospital stay, but now he felt more confident about managing the condition at home. However, if the infection is severe or doesn't respond to oral antibiotics, we might consider intravenous antibiotics in a hospital setting, the doctor added, ensuring John was aware of all possibilities. The doctor explained that in such cases the patient would be closely monitored to prevent any complications. John nodded, understanding the gravity of the situation. He appreciated the doctor's thorough explanation and felt more prepared to handle whatever came next. The doctor also provided John with a pamphlet that detailed the signs and symptoms to watch for, such as increased redness, swelling or fever, which could indicate that the infection was worsening. John took the pamphlet and read through it carefully. He wanted to make sure he was fully informed about his condition and the steps he needed to take to recover. The doctor advised John to schedule a follow-up appointment to monitor his progress. Regular checkups would ensure that the treatment was working and allow for any necessary adjustments. John scheduled his follow-up visit before leaving the clinic. He felt a sense of relief knowing that he had a plan in place and that he would be closely monitored throughout his recovery. As he walked out of the clinic, John felt more at ease. He was grateful for the doctor's guidance and felt optimistic about his recovery. With the right treatment and care, he was confident that he would overcome this infection. Over the next few days, John diligently followed the doctor's instructions. He took his antibiotics on schedule, kept the affected area clean, and rested as much as possible. Gradually, he began to notice improvements. The redness and swelling started to subside and he felt less discomfort. John was relieved to see that the treatment was working. At his follow-up appointment, the doctor confirmed that John was responding well to the treatment. The infection was under control, and he was on the path to full recovery. John thanked the doctor for his support and guidance. He felt grateful for the care he had received and was looking forward to putting this experience behind him. As he left the clinic, John felt a renewed sense of hope. He knew that with the right treatment and a positive attitude, he could overcome any challenge that came his way. "Is there anything I can do to prevent this from happening again, Doc?" John asked, determined to avoid future discomfort. "Absolutely, John. Good hygiene is key," the doctor emphasized. "Wash any cuts or wounds thoroughly with soap and water and keep them clean and covered. I'll be more careful with my shaving from now on." John chuckled sheepishly. "That's a good start," the doctor smiled. "Also, moisturize your skin regularly to prevent dryness and cracks, which can become entry points for bacteria. And if you have any underlying conditions like diabetes, managing them well can also help prevent skin infections," the doctor added, emphasizing the importance of overall health. "Before we proceed with any treatment, John, I'd like to run some tests to confirm the diagnosis and rule out any other possibilities," the doctor explained, rising from his chair. "It's important to be thorough and ensure we are addressing the right issue. Misdiagnosis can lead to ineffective treatments and prolonged discomfort, which we want to avoid at all costs." "That makes sense, Doc. I appreciate your thoroughness. I've been dealing with this issue for a while now and I just want to get to the bottom of it," John agreed, feeling more at ease with a clear plan in place. The uncertainty had been weighing on him, and knowing that the doctor was taking a methodical approach provided a sense of relief. He had been to other doctors before, but none had taken the time to explain the process so clearly. "I'll take a swab of the affected area to identify the specific bacteria causing the infection," the doctor continued, preparing his instruments. This step is crucial because different bacteria require different antibiotics. By pinpointing the exact cause, we can tailor the treatment to be as effective as possible. This will help us determine the most effective antibiotic. Not all antibiotics work on all bacteria, and using the wrong one can sometimes make things worse. We want to make sure we're using the right tool for the job. No problem, Doc. Whatever it takes to get this sorted out. I've been in discomfort for too long and I'm ready to do whatever is necessary to finally get some relief, John said confidently, ready to tackle the situation head-on. He had been feeling helpless for so long, but now he felt empowered by the doctor's clear plan and thorough approach. It was a refreshing change from the vague advice he had received in the past. Great, John. We'll have the results back soon, and I'll call you to discuss the next steps, the doctor reassured him, leading him out of the examination room. The doctor's calm demeanor and clear communication had a soothing effect on John. He felt like he was finally on the right path to recovery. The anticipation of the test results was still there, but it was now accompanied by a sense of hope and optimism. John left the office feeling lighter, knowing that he was in good hands and that a solution was within reach. As John left the doctor's office, he felt a sense of relief. Though he was diagnosed with cellulitis, the doctor's clear explanations and calm demeanor reassured him. He knew what he was dealing with, how to treat it, and most importantly, how to prevent it in the future. John was confident that with proper care and attention he would make a full recovery and be back on his feet in no time.